Welcome to Westmead Hospital. We understand you may be very nervous about your upcoming surgery and have a lot of questions. In this video, we will show you our hospital and explain what is going to happen at various steps of your surgical journey with us, and what you can do to make a quicker recovery. Before surgery, you will be given an appointment to attend for an assessment at our pre-admission clinic, which is located in the University Clinics block on level 2. You are very welcome to bring a family member with you if you wish. If English is not your first language, please ask our staff to arrange an interpreter for you in advance. Please don't forget to bring all your current medications, medical results and paperwork, as this will help us make a more thorough assessment. Our nurses will first measure your heart rate, blood pressure, oxygen saturation, and check your blood glucose level if you are diabetic. We will also measure your height and weight. An ECG or a lung function test may be performed depending upon your medical condition. You will then meet our anaesthetic and surgical teams, who will ask you your medical history and do a physical examination. They will explain your anaesthetic options and the operation to you and answer any related questions which you may have. We may ask you to go for more investigations or blood tests after the consultation. During the consultation, our team will go through all your medications and give you verbal and written instructions on what to do with them before surgery. If you are a smoker, we strongly advise you to stop as soon as possible, as this will dramatically improve your lung function and reduce post-operative complications. There is plenty of resources available to help you to quit, and you can speak to our team at any time. You may be given some information leaflets relating to your surgery to help you understand more about the operation and the post-operative care. We strongly advise all our patients to exercise at least 30 minutes every day before surgery if they can. These exercises will strengthen your muscles and make for a more speedy recovery. You should also have plenty of rest and sleep during this period. You should eat plenty of healthy and protein-rich food before surgery. You should also reduce or eliminate alcohol. In some circumstances, we may suggest a protein supplement drink to you. It is often a good idea to see your GP and a dietitian for advice, especially if you are overweight or underweight. The day before surgery, you will be given a telephone number to ring to find out what time you need to arrive at the hospital. You should keep yourself well hydrated and follow the perioperative instructions. Fasting is essential prior to sedation or a general anaesthetic. Non-fatty solid food may be taken up to 6 hours prior to anaesthesia. Patients are encouraged to drink clear fluids for up to 2 hours before arriving at the hospital. Please take all your essential medications as instructed by your anaesthetist or surgeon. Speak to our doctors if you have any fluid restriction. These clear fluids are acceptable: clear apple juice, black coffee, black tea, water, and sports drink. On the day of surgery, please make sure you bring the following items. To help reduce wound infection, we advise you to have a proper shower the night before your surgery with an antibacterial agent or neutral detergent, and repeat this on the morning of your operation. On your day of surgery, take one of the lifts opposite to the pre-admission clinic to the admission office on level 3. You are very welcome to bring one close family member or a friend with you. It is preferable if your family member or friend keeps your belongings and delivers them to your ward after the operation. Our porters will deliver your belongings if this is not possible. You will then be seen by our perioperative nurses. They will check your observations to make sure you are fit enough to have your operation. Your personal details will be carefully checked and you will be given a hospital identification wristband to wear. The nurse will instruct you to change into the hospital gown and put on the surgical hat. You may be given stockings to wear to improve the circulation in your legs. You will be met by our surgeons to answer any questions which you may have about your surgery. They will explain the operation to you and get you to sign the consent form if this has not already been done. If needed, they will mark the site and side of your operation. Our anaesthetic doctors will meet you before surgery. They will examine you and ask you a few questions to make sure you are ready for your operation. They will go through your anaesthetic and pain management options and the recovery period. They will also answer any questions or concerns which you may have. When you are ready, you will be taken to our theatre for your operation. Your family member or friend may accompany you to the door of the theatre suite. Our perioperative nurse will meet you in the anaesthetic room and ask you questions about your identity and operation again. We know this may seem repetitive to you, but in order to reduce mistakes, we must check these details at every stage of your journey. The anaesthetic doctor will then put a drip into your vein and give you anaesthetic medications. The anaesthetic doctor may inject some medication into your back as part of the anaesthetic and post-operative pain management plan. Local anaesthetic and sedatives may be given to make you feel more comfortable before the procedure. Sometimes the anaesthetic doctor may insert a peripheral nerve block with the aid of an ultrasound machine to numb the area where the operation will take place. Before you go to sleep, our staff will attach various monitoring devices to you to measure your vital signs throughout the operation. Before the start of the operation, the whole theatre team will pause for a safety checklist to ensure everyone is prepared and knows all essential information about you. During the whole time of your operation, your anaesthetist will closely monitor your vital signs. They are experts at keeping you safe and minimising your pain. Your dignity is important to us and we will keep you covered as much as possible. We will also keep you warm during the operation to reduce the risk of wound infection. After the operation is finished, the team will stop for another safety checklist to make sure everyone is aware of your needs in recovery. After surgery, most patients will be taken to the recovery room unless they have cardiac surgery or require immediate post-op ICU monitoring. Oxygen therapy will be given to you while you are waking up from the anaesthetic. Our recovery staff and anaesthetists will closely monitor you for a period of time and keep you comfortable before you are transferred to the ward or the high dependency unit. Medications will be given to you if you have pain or feel nauseated. At this point, your significant other and family relatives are welcome to inquire which admitting ward you will be going to. We understand they are concerned about you, but we appreciate their patience when our staff are focused on looking after you during this critical period. On the ward, you will be reviewed by your surgical team every day to make sure you are making good recovery progress. Some discomfort after surgery is expected, and our pain team may be asked to see you if needed. The length of time it takes to recover from surgery varies with different types of operation and your body's responses. There are things you could do to help yourself recover quickly. When you lie in bed after surgery, your lung bases may not expand fully and put you at risk of developing a pneumonia. To help your lungs expand, regular breathing exercises are strongly recommended, such as using the incentive spirometry device several times every hour. We strongly encourage you to sit out of bed and mobilise when possible to regain your muscle strength. This will help reduce the risk of surgical complications and also the risk of a blood clot in your legs or lungs. If you are unsteady getting up yourself, our nurses and physio will help you. For a quick recovery, it is vital for you to continue eating a good balanced diet. All our dietary plans are designed to provide the necessary nutritional requirements. If the hospital food doesn't suit you, we encourage your family members to bring you the home-cooked food that you prefer. We may refer you to our dietitian colleagues if we think this will benefit your recovery. When you are ready to be discharged, you will be given a discharge letter and details of your follow-up appointment from our nursing staff. You will be given the discharge medications you require and advice on equipment you may need. If necessary, our allied medical health teams will visit you to help you transition from hospital to home. Thank you very much for taking the time to watch this film. We wish you all the best with your upcoming surgical journey. Please feel free to ask our staff to your surgery at any time. We look forward to hearing feedback about your experience, as this will help us continually improve our service to you.